Today, I am talking about how to break free from topical steroid withdrawal, also known as TSW. Now, this is a big topic and a very big emerging clinical problem in today's world, especially when it comes to people who have eczema, because one of the most commonly used medications are topical steroids. And when there are very acute situations, we're also using oral steroids. And so this is a very big problem because when topical steroids are being used repeatedly in large areas, and we'll kind of talk about the reasons behind why this is really an emerging clinical problem, then we really see that we end up with this, syndrome called topical steroid withdrawal. We also call this red skin syndrome, and we also call it topical steroid addiction, and it's very well known as TSW nowadays. So we are going to talk about this today, and again, such an important topic because it might be something that you have never even come across and your doctor may have not even told you about. So first, we're going to talk today about understanding steroids and what the process of steroids is. What is the mechanism? How does it actually work to help lower inflammation on our skin? We're going to talk about the risk factors, the causes, the symptoms, and the stages of TSW. We're going to talk about the clean body approach to healing TSW from the inside out in a two-phase approach. And finally, we're going to go into your questions, and I'm happy to answer any and all questions on this topic. So please, as I'm going through today's live, please go ahead and type into the comments box, into the chat box. Please go ahead and ask all of your questions, and I am very happy to answer all of those questions today, and I will be answering them at the end. Okay, so just type your questions into the comments, and at the end, I will answer those. And I'll just be talking for about 15 to 20 minutes about TSW so that we can get a little bit of background. And then I'd love to answer any and all of your questions about this topic. Okay, so let's dive in. First off, I am really familiar with TSW. That's because I went through TSW myself. When I was pregnant with my daughter over 16 years ago, it was the first time in my life, in over 25 years of my life at that time, that I wanted to stop using topical steroids. So I stopped cold turkey when I found out I was pregnant, and I ended up getting what's called TSW, or red skin syndrome. And I basically had a sleeve of red on my arms. I had a sleeve of red on my neck, my torso, and it was red, oozing, hot, painful. I had fatigue. I couldn't sleep. I was in so much pain. So I know this very intimately. And now, as a naturopathic doctor and someone who specializes in eczema, TSW is something I encounter very, very frequently, unfortunately. And often when I'm seeing patients, we're not only dealing with eczema, but we're also dealing with TSW. And so we're going to look at how at Clean Body we address and tackle TSW in a two-phase approach, because we can't just tackle eczema the same way, because it's not just eczema we're dealing with anymore. So we'll talk about that in a little bit, but let's talk first about what are the topical steroids that we might encounter. And, you might know some of these names: clobetasol, hydrocortisone, triamcinolone, and there are a number of other medications that are all topical steroids. And then, of course, there are oral steroids as well. Prednisone is one of the most common. So if you have ever taken any of these steroid medications, this is something that you really want to think about when you are using these topical and oral steroids. So how do steroids work? Well, steroids, or corticosteroids, really help to reduce inflammation when they are used. And so corticosteroids such as cortisol, for example, are produced by the adrenal glands, and they play a really vital role in regulating inflammation, your immune response, and even metabolism. So what happens is when your body encounters stress or inflammation, cortisol is released into the bloodstream, and it binds to these receptors in target cells. And once it is bound, cortisol really modulates the gene expression, leading to the suppression of pro inflammatory genes and the upregulation of anti inflammatory genes. And so, what this results in is the inhibition of inflammatory mediators like cytokines. And this is, one of the ways that our medications work is really just kind of lowering those cytokines which cause the itchiness, like interleukin 4 and interleukin 13. And this really decreases that inflammatory response. Okay, so a lot of our medications do this, and not just topical steroids, but also, a lot of our biologic medications for eczema also target these cytokines. So this is just taking a different approach, and it's taking a more corticosteroid approach. Cortisol also does help with the skin barrier function. It also helps to promote tissue repair. And so it works beautifully, right? I mean, when we use topical steroids, it's almost like magic that inflammation on our skin just gets immediately better, right? So of course, this is something we are going to use, and unfortunately, sometimes our doctors aren't educating us about how to use it. Sometimes they are, but we're just in so much pain, or we just want that really quick fix that we just use these corticosteroids in ways that we're not supposed to, even though our doctor has told us, use it for a short period of time, don't put on your face, etc. But you might be needing that immediate response, and so you just use it. So what happens is TSW. And, there are several risk factors for topical steroid withdrawal. So, first of all, if you use corticosteroids on your face, there is a 90% increase in the chance of getting TSW. So, that's why doctors may tell you, use it minimally on the face or don't use it on the face at all. If you have a history of atopy or, atopic dermatitis or eczema, then there's a 76% increase in your risk for TSW. If you use oral corticosteroids, there is a 42% increase. So things like prednisone, and typically these are used in those emergency situations. If you're female, unfortunately, there's a 79% increase in the risk for TSW. And this could be due to the hormones. Our hormones are very delicate and very complex. And when we disrupt those steroid hormones, we are not only disrupting cortisol or cortisones, we're also disrupting our sex hormones like estrogen, progesterone, testosterone, potentially, because they are in really similar pathways, and those are also steroid hormones. If you are over the age of 18, there's an 83% chance. So, we're seeing that adults are suffering from this more. If you are using corticosteroids of medium to high potency, this can be a problem too. So those higher potency steroids, so if you're using something over the counter, you'll have less of a possibility for maybe getting TSW. But if you are using corticosteroids for a long period of time, even if it's those low potency steroids, if you're using these steroids for 6 months or more, you're having a 63% increase in the risk for TSW. Okay, so if we think about these items, then we can maybe say, okay, let's make sure that we are not using it on our face, that we're not using the corticosteroids every single day, for 6 months or longer. We're not using those medium to high potency steroids. We're using those low level steroids instead. Or we don't use these topical steroids at all, would maybe even be a better choice. And using these more as an emergency situation is how I would like you to think about it. Okay. So, what are the causes of topical corticosteroid withdrawal, or how does it look? Well, if you continue using corticosteroids, you will eventually see this reduced response where you are going to need more and more and more of the corticosteroid, higher potencies, or just more frequent use. So when that happens and you start to get that reduced response, you're already starting the process of topical steroid withdrawal. Okay. So that's one thing. If you're noticing your topical steroids just aren't working anymore, then you want to start thinking, I need to start thinking about this. Okay. There is an upregulation of glucocorticoid receptor B, and this can contribute to a poor response to those topical steroids and then those withdrawal symptoms. Okay. When you are using topical steroid withdrawals, topical steroids, you are actually suppressing your own cortisol production. And that is actually happening in your skin cells. And so when you take away those topical steroids, your body basically continues that suppression of its own cortisol production. And then you aren't getting that anti inflammatory aspect that cortisol produces. There is a vasodilation that happens. So, this is a rebound vasodilation. And that's where with TSW, we can see this redness, this heat emanating off of the skin, and it's burning and it's painful. And that is because initially, when you use a topical steroid, you're going to have this vasoconstriction that happens. And then when you have the withdrawal, instead of that vasoconstriction, you're going to have a vasodilation. That means that all the vessels are going to open up and all that blood is going to flow through. And that's why you're going to get redness. There's a nitric oxide release that happens here that causes that redness or skin erythema. And then when you eliminate the topical steroids because they were promoting that skin barrier, you are now having a skin barrier disruption, which can lead to this rebound cytokine or inflammatory cascade that will happen that will cause more itchiness, more redness. So, altogether, it's not a great situation when we end up in a TSW situation. So there are so many symptoms that come with topical steroid withdrawal, and the list is very long. So let's go through that list because there are physical symptoms, not just skin symptoms. Because again, we're talking about corticosteroid withdrawal or cortisol withdrawal or cortisone withdrawal. And this is a adrenal hormone. This is a hormone that does so many things in the body. So when we are having withdrawal, we are having a problem with this hormone, and really that extends to almost all parts of our system. The physical symptoms include burning pain because of that vasodilation we talked about earlier, severe itch, skin sensitivity, insomnia because we're messing with the hormones, low mood. You're having an intolerance to emollients. So if you are someone who has started to have, like, you put anything on your skin and you're just having this intolerance, that could also be a symptom of TSW. Now, if we move on to the skin features, of course, we're going to have that red skin, elephant wrinkles. So you can see this kind of really thickened elephant skin. So it's just very wrinkly and thickened skin. Again, that red sleeve sign we talked about earlier. There's also a headlight sign. This is where the face is red, but the nose and the area around the mouth, or the perioral area around the mouth, uh, is not red, but you have every other part of the face red, and we call that the headlight sign. You're going to see a lot of shedding of the skin, so a lot of flaking during parts of the healing process, and even edema, which means a swelling. So you might see like your legs are swelling up. And then along with that, you might see an exudate. So this is a fluid that is clear. It's often clear, a little bit yellowish tinted, and this is rich in proteins and cells, and this can indicate that there's inflammation, and the body is kind of sending these proteins to heal things, but you're seeing this exudate come out. So we call that skin oozing. Sometimes there are papules or nodules. These are little raised bumps that can vary in size, in some TSW cases, and then dilated blood vessels. So you can see little red blood vessels that you might see along with the redness of the skin. There are two different subtypes of TSW. So, when someone has eczema, we often see that the TSW looks more like redness, swelling, edema, burning, because it is kind of layered on top of eczema and atopic dermatitis. And then we have another type, which when steroids are used more for cosmetic reasons or pigmentation issues, we're seeing that this type is more exhibiting those little bumps like the papules and the pustules, and then also redness as well too. But this type may exhibit fewer symptoms of stinging and redness and swelling than someone who has atopic dermatitis underlying that TSW. There are several complications that come with TSW. Of course, that intense itching and the sleep disturbance is huge. So in phase 1 of our clean body approach, we are always addressing this first. If you have eczema, you're seeing a flare in the eczema plus the TSW. So you're getting a double whammy, unfortunately. Of course, you're open now to more cutaneous infections like staph infections and yeast infections on the skin. Unfortunately, because everything is kind of opened and that skin barrier has really come down. We may also see depression and anxiety and even suicidal ideation, unfortunately, because this is a very difficult condition to go through. Personally, I understand this completely. I spent days in the bathtub. Just it was the only place I could feel comfortable because everything was just burning and everything was open and oozing. So I spent days in what I now call healing baths that I prescribe to my patients. But it was so incredibly painful. And then a lot of times people will have a phobia for using steroids, and very understandably so. Right now, you don't want to use steroids at all, and very rightly so. Now, how long does it take for TSW? Once you stop a topical steroid, how long does it take for TSW to happen? And that onset could be anywhere from 48 hours after you stop a topical steroid up to 3 months. So it may not be immediate, okay? Because you may see this rebound effect happen a little bit later, and again, it can take up to 3 months. There are stages that will happen when you are healing from TSW, and the hope is, if you work with a team like ours at Clean Body, where we kind of give this two-phase approach, which we'll talk about in a second. We hope that you go through these phases very quickly and you're good to go. So we're looking at, a patient here where she had a 4-month process, and that's a really fast process for healing TSW. But we're seeing that this first phase, stage 1, is where there's a lot of redness, a lot of inflammation. Then stage 2, we see exudate, so that oozing, and then scabbing of the skin. And then stage 3, we're going to see flaking. So a lot of flaking is just going to come off. It's kind of like as a snake, you're just shedding that old skin so that new skin can be revealed. And finally, we have that stage 4, which is remodeling. And this is where we're seeing, new skin, healthy skin coming up. And depending on what you are doing for TSW, this could be a long, drawn out process. This could become a secular process that just never ends. Hopefully, this is a process that goes through, 1 or 2 cycles and then you clear it. And so, how do you do that? Well, at Clean Body, we like to take a 2-phase approach. So, phase 1, we have to deal with the TSW itself. So, underlying, you might have eczema or maybe another condition, but we cannot deal with that right off the bat. And what we're going to do is give that immediate support for TSW. And what we're giving for that TSW is actually supporting the eczema as well. Okay. But that phase 1, we have to support the adrenals. So we might be doing things, and of course, at Clean Body, we are mostly using all natural supplements, herbs, food, lifestyle, to support this. So adrenal support may include adrenal glandulars, adaptogenic herbs, maybe vitamins like B vitamins and vitamin C, to support the adrenals to do the job that they need to do because they've been dormant for so long if you've been using a lot of topical steroids. We need to optimize sleep because sleep is often impaired in someone with TSW. So we might do, sleep hygiene things, of course, but then support, nutritional support, supplements, and, anything to really help the system to calm down if it's very worked up. And often in a TSW situation, we might see that someone's cortisol is even elevated at night. We need immediate symptom relief. So, there's that redness and that burning. So I love treatments like cryotherapy or cold therapy to really lower and vasoconstrict and really close up all that redness. So I love cryotherapy, either at home or at a wellness center. And then, depending on what a patient is experiencing, we might do healing baths, like I talked about earlier. We might do different topicals, and sometimes we might do no topicals. So there's a type of treatment called no moisture therapy that we might also employ where we don't do any topicals because the person is also having emollient intolerance. And so that could be another thing we do. We also have to give nutritional support because the body is now needing nutritional support. And, at times our diet is not giving us that nutrition that we need. for the body to start healing, for the adrenals to actually start working the way they need to work. And finally, we need to have mood balance support often. Often, I will see that there is depression, anxiety, suicidal ideation. Depending on how long someone's been dealing with TSW, this is a very, very difficult thing to go through. And so we have to also support that. So, phase one, we are actually assessing this for our patients and trying to understand, okay, what pieces of this puzzle, often in a very severe TSW case, I need to do all 5 of these all at once, supporting all of this so that the person can even just make it through the day to get to the next phase. And the next phase is where we actually start addressing the root causes of the eczema itself, because TSW is a different problem, right? That's a problem because you were using topical steroids. Now, the second problem is, okay, why were you even using topical steroids in the first place? Well, it's because you had eczema. So, with eczema, we now need to evaluate the root causes of eczema. That includes microbiome imbalances, toxic burden, leaky gut, leaky skin, nutritional factors, and lifestyle factors. We need to assess this and understand, okay, what root causes are present for you. And we need to make sure, though, that your adrenals are supported and all of that first. So that's why phase one comes first. And then phase two is where we really then tackle the eczema itself. Now, in phase one, that may take anywhere from 1 month to 3 months, hopefully not longer than that. And then addressing the root causes of eczema typically takes a minimum of about 3 months. So when we're working with someone with TSW, we are sometimes seeing a 4 month to 6 month process where we really need to do the 2 phases here. And as we saw earlier with one of my patients, it was a 4 month process. So that's really our best case scenario, that first of all, the patient is just gung ho, like, let's do it. I'm ready to do it. Part of this is we need to have trust in the process. We need to have positivity, and it's very hard, understandably, to have positivity as we're going through this process. And the more positive someone is in, okay, my body's going to heal, I have to give it time, I understand the process that needs to happen here, then the faster that can really be. But I often see 4 months is typically the minimum time I see my patients really being able to kind of get through this. Our hormones, a lot of them have a lifespan of about 3 months. So, 3 months would definitely be a minimum overall time. And then, maybe a more of an average of anywhere from 4 to 6 months. If you want to understand a little bit more about the root causes of your eczema, if you're potentially having TSW, I do recommend that you take our free 3-minute eczema root cause assessment. That may help you to understand what those root causes are for you, and what would we need to address secondarily if you think you are going through TSW. So if you do think you are going through TSW, if you're listening to this and you're kind of like, oh my gosh, I'm going through all of these symptoms. Well, the first thing is, you need to get some support, because this is something that's very difficult to go through on your own. A lot of times, it's just even hard to get through the day, as most of us know, if we have some of these symptoms. So having a really supportive team is very important. Having a team that understands TSW is very important. Unfortunately, in my practice, this is a big part of our practice. This is a lot of what we do for a lot of the people who come in, and a lot of them often don't even know they have TSW. I think that's one of the worst parts, is like you're dealing with really a condition that's not necessarily, I guess, widely known or widely accepted in the conventional community, that your dermatologist may not have even told you that this is going on. Your dermatologist may not even be aware or know that this is a possibility. And hopefully your dermatologist does know and understand this, okay? So if this is something you're dealing with, I definitely recommend, first off, taking the eczema root cause assessment, understanding what the root causes are for you so that you can maybe start to understand and address those items. But at the same time, really, really finding a team that can support you in this journey. And again, this is what we do at Clean Body. So our team is available for you if that's something that you are interested, okay? And if you are going through TSW, know that there is a light at the end of the tunnel. There is a way to get through, and there is a way to get through where you can get through this, within 4 to 6 months. is really my experience, and hopefully that will be what you experience as well too. All right. So if you are interested in booking a one-on-one eczema consultation, it is now only $97 for a limited time. So go to the link in my bio, click book a consultation. We do have a money back guarantee on it. And if you do decide to join us, that fee actually gets applied towards your care with us. So it does become free if you decide to join us. All right. As a reminder, this is for informational purposes only. This is not medical advice. And if you are interested in getting medical advice, then definitely consider booking a consultation. And now I'd love to open it up to questions. And if you guys have any questions, please go ahead and type into the chat box now. And I'm happy to answer any and all questions on this topic. And let's see, I will go back and see if there were any questions that came up. Dermatologists have zero idea and zero solutions except biological and JAK inhibitors. Absolutely. So I know we are talking about topical steroid withdrawal today, but those are some other types of medications that have their own problems. But what we're talking about today is topical steroid withdrawal. But, um, I would say dermatologists, they are trained to address the symptoms. And just the difference is, as a naturopathic doctor, I'm trained to address the root causes. And I think that, the conventional medications there's a time and a place for those conventional medications. And unfortunately, in the conventional model, we're not thinking of those as emergency situation type medications. We're thinking of that as that's the only answer. And what I'm here to tell you is that it's not the only answer, okay? And I know this personally because I have been through this myself, and I have healed my TSW and my eczema, and I'm completely eczema and TSW free. And so, I know that it's possible personally. And then clinically with, all of the patients I have treated now, it is very possible. Okay. Is the COVID vax causing these problems you are talking about? That's not what we're talking about right now. We are talking about topical steroids as a problem, and with someone with eczema, how these are frequently used and can lead to withdrawal when we are using them too often. In terms of the vaccines, that's kind of a different topic, and it really is not related to this, in terms of the topic we're talking about. And I don't necessarily think that the vaccines are necessarily, causing these types of problems. And I think, there could be some people who have issues when they get the vaccine, and I think that's on a case by case basis. My 3-year-old is currently going through this. Her steroid ointment ruined her skin barrier. I'm so sorry to hear this. And I'm so sorry to hear such a young one is going through this. This can be extremely difficult for an adult. So for a child to go through this, it's even harder. In terms of dealing with this with a 3-year-old, it's ever more important to work with a team to support you, because this is not. So if you don't do the things I mentioned, like the phase 1 and the phase 2 support for TSW, this could take a long time to heal, unfortunately. The younger somebody is, the faster it is, hopefully. I would like to say we're more vital when we are younger, and the older we are, sometimes we're not as vital. But it can still take a long time for the hormones to rebalance themselves. So it's important to work with a team to get this done faster. We can use herbs and supplements and things like that to push the body into healing. Okay. So that's really what we want to do there. And with a 3-year-old, I would highly, highly recommend that, that's something we do so we can just get this done as quickly as possible. And even in that, even with doing that, this may not be an overnight sensation. As I mentioned, 4 months is typically 3 to 4 months is typically like the lowest amount of time I've seen anyone get through this. And even during that period, we're just seeing, ups and downs and cycles. And so in my practice, I really like to check in with the patients every single week. We have them fill out update forms every week. We contact our patients every week. We look at pictures every week, because TSW is ever changing. So as the different elements of TSW are coming up, we like to support all those different elements, in different ways. Okay. All right. And if you guys have any other questions, please go ahead and type into the chat box now. And again, I'm happy to answer any and all questions in terms of TSW, which is topical steroid withdrawal. And that's what we're talking about today. And this is where you have been using topical steroids for a long period of time, or you've been using very strong steroids, or maybe you've been using them on your face. And unfortunately, not only are you, getting the topical exposures, unfortunately, you are getting systemic exposure to these steroids. That steroid is going into your body and causing problems. Okay, so it's not just something topical. My wife is paid for her introductory call with you, but she hasn't felt up to meeting with you yet. I know you have covered this in other IG lives. Do you have, Grant D. Cooper, can you just finish that? Okay. Advice for eye eczema. Okay. And it depends what you're talking about, actually. I think for eye eczema, is that she's getting this red around her eyes, almost like a raccoon, but it's red. That actually could be a sign of TSW, for one. And I would have a question as to what does that mean that she hasn't felt up to meeting with me yet? Because what I would like to say to that is, if we can get started ASAP, we can start getting her help by today. You know what I'm saying? As soon as we meet, if we're able to see each other pretty soon after that, and the more severe a case, I do try to get you in faster so I can give you help as soon as you possibly can. I know what it's like to be in this situation. I know that every day is a struggle. I know that every minute of every day is a struggle. And so I would encourage your wife to book. You guys have already paid for the call. Is just book the call. And if you got messaged my assistant today, she can potentially get you in tomorrow. And I do think that can get her some relief quicker, because I don't have generalized advice for anyone with TSW or eczema. And in my blogs, you'll see that there is advice that's all across the board, but any one any one thing is not going to help everybody. And you could be chasing a train for a long, long time and never catch it, because you're not actually getting to the root cause of the problem. So it's hard for me to give exact advice for eye eczema if I don't see the pictures, if I don't understand what's going on. And it would be easier for me to give that advice if we actually did have that call together. So I'd recommend that you try to book that call as soon as you can, especially. And I don't know what that means, if she's not feeling up to it, if she's in so much pain, or, if you guys aren't just ready to move forward with care. But even in that introductory call, I will, break down all the different options for you and start to give you, some tools to kind of help you on your journey. So to answer this, I would say definitely book that call, since you guys have already paid for it. Try to get on my schedule as soon as you can. And I am going to be leaving for the holidays. So tomorrow is a chance for you to do that, partly in pain. Okay. I totally understand this. And I understand, because I understand that when you're in this pain, it's like even being on a call is too much. Standing up is too much. Showing your Zoom is too much. You know what I'm saying? I get it. But if you don't want to show your Zoom, don't show your Zoom. Let's just talk. Let's just figure out what's going on. And husband, maybe you can help her by taking some pictures. And, so when I do meet you for your first call, I like to see pictures of your skin. I like to see pictures of your poop. I like to see pictures of your food. I like to see pictures of everything, so that I can really get a good idea of what's going on and really help you guys to understand, okay, what would this process really look like for you? What testing do I think we need? What does treatment look like? And if she is going through this, then again, we need to go through phase 1. It's immediate support for TSW is what we need to do. We need to get her out of that super painful time frame where she now feels like, okay, I can get up and do stuff. And so, we just had one patient who had just severe, severe, severe TSW. and he's now back in his own apartment, and and he's getting his life back in order and all of that, and he had to stay with his parents earlier. So that can be just in itself is what we're trying to get through, is like, let's give you your life back first, and then let's kind of get deeper and go to the root cause, and let's clear this forever so that you don't have these problems ever. Yes, the poop has been a barrier. Okay. The poop as in taking the pictures of the poop. If the taking of pictures of the poop is a barrier, then don't do it. Okay. And you guys don't have to do anything you don't want to do when we work together. So if that's a barrier, just don't let that be a barrier. Okay. Because if she is in so much pain, I want to offer her some support. And even in that first call, I can offer support already, just kind of at least point you guys in the right direction, for her to get some more immediate relief. When you guys sign up for the consultation, you guys also get my eczema relief guide. And in the consultation, I can kind of help walk you through the parts of that you might want to try, to get more immediate relief. And so you'll get that too. Okay. You're very welcome, Grant D. Cooper. And I hope to talk to you guys soon. And I have such a big, place in my heart for anybody going through this. I just remember being in that tub in so much pain and nobody there to help me. And it's actually why I became a naturopathic doctor. I found a naturopathic doctor in the middle of my pregnancy. It was the first time I felt supported. It was the first time that I actually got help for real. My skin started feeling better within 2 weeks of seeing the naturopathic doctor. And that was it. I went to naturopathic medical school when my daughter was 4 months old. So it changed my life. And so that's why I have just a big, big heart for anybody going through this. And so, I would say, Grant D. Cooper, let's get your wife on the schedule. Let's see what we can do to help the situation, even if it's just a little bit of help right now, just to get her through the next day. Okay. All right. If you guys have any other questions, please type into the comment or chat box. I'm happy to answer any and all questions. Thank you to those who have asked some questions and made some comments already. And this is a really important topic. It's really a big problem, and one that some of us don't even know is going on with us. So I'm hoping that this kind of unravels it a little bit for people. Maybe you hear this live and you're like, oh my gosh, this is what I'm dealing with, and I did not even know it. And I hope if it can touch even one person and help you to now find the resources you need, that I've helped at least one person. All right. So I do these lives every week. And so definitely tune in. This live will also be published on my podcast, which is Live with the Eczema Doc. And you can find that on all podcast platforms. If you guys have any other questions that you think of later on, just DM me. I'm really happy to answer any and all questions. And I hope you all have a wonderful week, and I will see you next week. All right. Bye, everyone.